it's sad in a way because the Black community is more impacted by COVID than many other communities. And so if the latest surveys seem to continue to show that Blacks say that they're going to take the vaccine at a much lower rate than whites, and that Latinx patients or people do. So the problem with that, of course, is for the individuals. It will mean that there are fewer people in the community who are protected, and more people are likely to get sick, and more people are likely to die. It also creates a community problem in that it means there is more virus circulating around in the community, and so that we may find ourselves in a situation where the virus has been tamped down. There are fewer infections in other communities, but the Black community has become even more of an epicenter of the disease, because even if you're being careful, I mean, one of the things that people find hard to understand is the exact same activity. Let's say you're outside with someone and they're 6 feet away. The how safe or not safe that is very much dependent on how likely it is the person you're talking to has COVID. And so in a community where there's very little COVID around, exactly that same activity, being in an elevator with someone or being next to them in the store, that may be very low risk. Whereas exactly the same activity in a community where the prevalence of the virus is much higher, the chances that then that person I'm talking to has COVID and will spread it to me is much, much higher. So it's going to be really, really important that all communities feel comfortable taking the vaccine. And the risk is not only to the individual who's choosing not to take it. It then means that person is more likely to get it, to carry it, to be an asymptomatic carrier, and to give it to other people. And if it tends to be a relatively homogeneous community where most of the mixing is with other people in the community, you've just set yourself up for that community to be a hotspot and continue to be a hotspot even as other communities are finding themselves quite free of the virus.
Everything Bob has said just reinforces the need to extend the benefits of this vaccination to our entire population in its wonderful diversity in this country. And we particularly have to reach those populations, the Black population, Latinx population, other minority populations in the United States who have, for lots of reasons, less access to medical care, historical reasons to mistrust medical care, to be concerned about medical experiments being done. And we need to not only provide them the information, but a sense of reassurance and comfort that this is the right thing to do. It's good for them, it's good for their neighbors and their family. And we would like to encourage them to participate in this wonderful prevention modality that looks like it works wonderfully.
And I can tell you that the Biden people are thinking about this very, very, very carefully, very extensively, and recognize that the person that needs to perhaps convince someone to take the vaccine, it may not be Dr. Fauci, it may certainly not be me, it may be, it's probably Bill.
No, not me. Notice
it may be that
I'm not dark enough.
Or it may be the clergy member.
You have to look like the population you're trying to convince.
Whether it's a person who looks like the population, it's important. It's trying to figure that out.